Hello, and welcome to the Rosalind Carter Institute for Caregiving GDAS webinar series. Before getting started, please remember that the link to the SurveyMonkey post-test will be pasted onto the last slide. The post-test will remain open for an indefinite amount of time. Please take it at your earliest convenience, though we encourage immediately following the webinar. Today's webinar will be Recognizing Risk Factors, Family Caregivers, presented by Shiloh Wolf. Shiloh Wolf is the new Training and Implementation Specialist for Operation Family Caregiver, RCI's Military Caregiver Support Program. Shiloh is originally from Palm Beach, Florida, and came to Georgia by way of the military. Shiloh served 7 years in the Army on active duty in the infantry as a squad leader, survival and combat tracking instructor, and a battle mine specialist, suicide intervention. He has continued his military service in the Army National Guard, where he is currently an intelligence analyst. Upon leaving active duty, Shiloh then went to work as a police officer with the Columbus Police Department as a CIT officer, Crisis Intervention Team. Recognizing the need and value of a good interventionalist, Shiloh decided to expand on his training and education in forensic psychology, concentrating on crisis intervention negotiation. Shiloh left the police department and became a caregiver interventionalist with the RCI REACH program at Phoebe Sumter Medical Center to help caregivers whose loved ones suffer from dementia, and has since moved on to work here for RCI. Welcome, Shiloh.
Thank you very much. I appreciate the warm welcome. Hello, everyone, and welcome to the presentation. I hope you're doing well. A little bit of a disclaimer ahead of time. This presentation is a little text heavy. Some of the animations were not added over to this particular delivery platform. So I advise, and it's advisable, that if you have a pen and a piece of paper, to take some of the core notes out of this that's relevant and important to you, I recommend that now. Some of the things that we're going to be covering today, the intent of this presentation is to identify some specific risk factors and signs of mild cognitive impairment, which may lead families to seek an early diagnosis and treatment earlier within the progression of dementia. We will also cover some precognitive impairment topics that include the benefits of preparation, planning, and healthy lifestyle considerations. This also includes getting regular checkups and seeing your doctor a little bit more often, and we're going to talk more about that as we progress. Exploration of these risk factors and preparation is essential for the family caregiver as well as your loved one and surrounding friends and family. Some of the areas of today's discussion include: we're going to define cognitive impairment in its general sense. We're going to explore the causes and signs and symptoms of cognitive impairment. Then we're going to identify some of the specific risk factors and signs of precognitive impairment as well as mild cognitive impairment. We're going to evaluate risk reduction and the benefits to early medical intervention and diagnosis. And we're going to observe habits that make for an improved healthy lifestyle. So let's get going. First, I want to talk a little bit about cognitive impairment. Specifically, what cognitive impairment means to you. When you think about what cognitive impairment is, what comes to mind? Does it mean that there is memory loss? Does it mean that your loved one is getting lost? Or what if they're following you around? Does it mean that they're losing items? Maybe you're losing items. What about difficulty with speaking or with speech in general? Do they have difficulty performing simple everyday tasks that seem like they should be relatively easy, or at least practiced? They've done it before in the past without any issues. Do they or could cognitive impairment cause uncharacteristic emotional disruptions? Do any of these apply? Do multiple apply? Or alternatively, do all of them apply? So let's take a look at what cognitive impairment is. Cognitive impairment is when a person has trouble remembering, learning new things, concentrating, or making decisions that affect their everyday life. The things that we just spoke about, do any of those fall into that kind of category? Sure they do. Cognitive impairment does range from mild to severe. With mild impairment, people may begin to notice changes in cognitive function, but still be able to do their everyday activities. When people experience mild impairment, mild cognitive impairment, they may still continue to go to work. They may still be involved with their community. They still may be doing the things that they've always done, but they're just having some difficulty. Severe levels of impairment can lead to losing the ability to understand the meaning or importance of something, and the ability to talk or write, general communications, which ultimately these things lead to the inability to live independently. If you lose the ability to understand the importance of, say, balancing your checkbook or paying the utility bills or your mortgage, or if you lose the meaning of what it is to have family or to be able to take care of, the family pet, those things can be impactful. And so, but of course, under the same severe levels, it can progress much more than that. So some of the causes, and we're going to bounce back and forth from the signs, symptoms, and causes within the different levels of impairment, but it's important to get out of the way now that cognitive impairment is not necessarily caused by any one disease or condition, and it's not limited to any specific age group. Alzheimer's disease and other dementias, in addition to conditions such as stroke, traumatic brain injury, and developmental disabilities, can also cause impairment. Because you have cognitive impairment does not necessarily mean you have dementia, and there is a difference. Dementia, on the other hand, is cognitive impairment. So as you can see, it can be a little bit confusing, but it's all about where it fits on this scale of things. And so as we progress, we're going to talk a little bit more about that scale. Some additional signs of cognitive impairment. They do include memory loss, frequently asking the same question or repeating the same story over and over again. And when we talk about that, it's not Uncle Joe's favorite joke that he likes to tell every time you see him, or your grandmother's favorite story on how she met your grandfather, or vice versa. This is very specific. It's take for instance, our loved one asks what time is it, and then they ask 2 minutes later, what time is it? And they ask a couple minutes later, what time is it? So that's a repeating behavior, and that's something to pay attention to. Repeating the same story. Oftentimes what we would see with an individual on the more severe side is they will recall a specific story from the past. In my experience, I see it with World War II veterans, or now even Korea or Vietnam veterans, where they'll repeat the same specific story. It may not have anything to do with war. It would have something to do with a particular friend on a particular day, on a particular date, or time. So it'll be very concise and very pinpoint, and we'll talk a little bit about why that is. But ultimately, it's very specific, oftentimes. Now, another sign is the individual may not recognize familiar people and places. Sometimes what happens is our loved one will, and how we kind of find out there is impairment, one of the things that occur is our loved one will go and they'll go to a common place. They'll drive out. Let's say they go to the bank, and that bank may be a little bit a ways away from the home. Where we're currently situated, we're in rural Georgia, so a bank might be 10, maybe 15 miles away. And what will end up occurring is that the individual will make it to the bank oftentimes okay, but on the way back they will get lost. And so, and then their loved one, their caregiver, or just their spouse or family member will start looking for them, and oftentimes it's a police officer or deputy that ends up finding them, and or sometimes a complete stranger, and they kind of help get that person back home, and that's usually one of the indicators that there is some form of cognitive impairment. Another sign is having trouble exercising judgment, and also such as knowing what to do in an emergency. So when we talk about exercising good judgment, this is things such as leaving the water running, leaving the stove on, and then in the event of an emergency, say for instance there's been a car accident, we see oftentimes individuals that have suffered cognitive impairment, they'll drive away, which, as you can imagine, can end up with a hit and run charge. But the truth of the matter is they didn't know what to do, so they just kind of went back into their routine, and so those sorts of things can occur as well. Some additional signs, we oftentimes see changes in mood or behavior. This is oftentimes a byproduct of confusion. Individuals who have cognitive impairment, particularly on the milder to severe side of it, we start seeing an increase of confusion, and so as a result we see combativeness and irritability. We also see increased calm and compliance. It just depends on how they react to that particular confusion. But that's not always the case. Sometimes just general frustration, the inability to perform a common task. Say for instance, the individual was a cook or a chef, and now they've lost the ability to follow a recipe. As you can imagine, that can be very frustrating. If your loved one was, a woodworker or a metal worker or something like that, and they can no longer use the tools, or any of those various skill upsets. Sometimes just the inability to track and pay monthly bills. We also see within some of the signs vision problems that usually is indicative of some type of cognitive and neurological upset. Now, some facts and statistics to consider. The Center of Disease Control estimates that 16 million people living in the United States have some type of cognitive impairment, and that number is growing. 5.1 million have been diagnosed with Alzheimer's disease, and that number is expected to grow to 3.2 million by 2050. So we're looking at an approximate uptick of almost 3 times what is currently diagnosed. Cognitive impairment is costly. We do know this. Individuals with cognitive impairment report 3 times more hospital stays than someone suffering from another condition. Alzheimer's disease specifically, or any Alzheimer's disease and other dementias, is the 3rd most expensive disease to treat in the United States. And this isn't just a matter of visiting the doctor a little bit more. This ranges from unskilled and skilled nursing, institutionalization, home care services, additional prescription medications. As you can imagine, the litany of services that would have to go into place for individuals, especially as they progress and become more severe. So we've talked generally about just cognitive impairment. Now we're going to focus specifically on mild cognitive impairment, or MCI. Now, mild cognitive impairment is the intermediate stage between the expected cognitive decline of normal age and more serious decline of dementia. It can involve problems with memory, language, thinking, and judgment that are greater than normal age-related changes. I should mention here that because you grow older doesn't mean that you're going to have dementia. Dementia in of itself is not a natural part of aging. But as we do grow older, there is a level of expected cognitive decline, and that varies from person to person. Some individuals live well into their hundreds, and they are as sharp as a tack, whereas others, they're completely functional. It's just they may have a hard time remembering names and dates and certain things like that. Whereas when we look at dementia, we start losing especially short-term memory, and we also start losing more skill level type things that for someone that is not experiencing any type of dementia or serious cognitive impairment would otherwise do just fine. Now, if someone you know has mild cognitive impairment, you may be aware that memory or mental function has slipped. Have you ever heard that expression? Oh, must have slipped my memory. Your friends and close friends may also, your close family and friends may also notice a change. So when we talk about mild cognitive impairment, there is going to be a noticeable change. It's going to be a little bit more than I must have forgot. We all experience that sensation when we're frantic and we're late for something and we run into a room, we forgot why we were in that room, and then all of a sudden it comes to you, oh yeah, where are my keys? And you're running around looking for your keys, and your keys are in your hand. We all experience that feeling, but again, this is a little bit different. You can take that as an example and make it more repetitious, and you would start to get a feeling of what it's like as it increases in frequency for your loved one. Now, generally these changes are not severe enough to significantly interfere with your loved one's day-to-day life or usual activities. Individuals who have mild cognitive impairment, as mentioned before, can still go to work, can still do what they've always done within the limits of their ability. And so specifically, if they're not supposed to lift things too heavy and stuff like that, sure, but they're able to do everything that they've done. It's just now we have to pay a little bit more attention. Mild cognitive impairment may increase your risk of later progressing to dementia caused by Alzheimer's disease and or other neurological conditions. But some people with mild cognitive impairment never get worse, and a few eventually get better. So circumstances where that would apply, let's say that the cognitive impairment occurred from a TBI, a traumatic brain injury, say from maybe a car accident or an impact sport or some type of assault or something that created a head trauma that did affect at some level cognition. So as people heal and get better, some of those symptoms may subside. With treatment, diagnosis, and medications, in those cases in particular, we could see an individual get better. Some of the strongest risk factors for MCI, increasing age. Again, not to confuse mild cognitive impairment or cognitive impairment specifically with dementia. Again, dementia is not a natural part of aging, but there is an expected level of decline of cognition as we age. So it would be one of the stronger factors. And then having a specific form of a gene known as ApoE4, which has been linked to Alzheimer's disease. Now, if you have the gene, that doesn't guarantee that you'll experience cognitive decline. But one of the commonalities with Alzheimer's disease is that gene. So it is a bit of hit and miss, but it does increase your risk. some medical conditions and lifestyle factors that have been linked to an increased risk of cognitive change do include diabetes, smoking, high blood pressure, elevated cholesterol, depression, lack of physical exercise, and infrequent participation in mentally or socially stimulating activities. When we get into lifestyles a little bit later, obviously you could assume what we're going to address in terms of some of the things we can be doing to improve our chances to not experience a higher risk of cognitive decline. But one of the things that your doctor, you may never have heard your doctor express concern about, is your participation or your loved one's participation in mentally or socially stimulating activities. Often you'll hear, check your diet, exercise, things like that. Don't smoke, don't drink. But not having mental or social stimulation is also a factor. Being able to be engaged in both our friends and our family, as well as keeping our mind sharp, are things that do improve cognitive function. Almost thinking of your mind as a muscle. The more you work it, the sharper you get. Your brain, like the rest of your body, changes as you grow older. Many people notice gradually increasing forgetfulness as they age. It may take longer to think of a word or recall a person's name. These are normal elements of growing older, and don't necessarily mean that you are going to progress to the point of severity. However, consistent or increasing concern about your mental performance may suggest mild cognitive impairment, or MCI. This is the point where we talk about what you think, and regarding to, okay, I'm forgetting things, I can't remember this person's name. That's okay in of itself. We all forget things, but if it's becoming increased in frequency, if we get to the point where it's starting to hinder your daily routine and activities, now we need to start thinking about what that really means, and it could suggest mild cognitive impairment, and that's when we want to have our doctor take a look. Cognitive issues may go beyond what's expected and indicated possible MCI if you experience any of the following or all of the following. You forget things more often. So again, that's increasing the frequency of your forgetfulness. Your loved one forget important events such as appointments or social engagements. Say a granddaughter or grandson is getting married or having a child, and you completely forget that's a thing. That's something to think about. That's a major event. You lose your train of thought or the thread of conversations, books, and movies. You're watching your favorite movie and you forget what it's about halfway through, or you're engaged in a conversation, and even if the conversation is interesting, you forget what it was originally about. These things are considerations. You feel increasingly overwhelmed by making decisions, planning steps to accomplish a task, or interpreting instructions. So going back to the chef or the cook who's following the recipe, when they look at a recipe and to the trained eye may seem like a relatively simple recipe, but looking at it and trying to kind of follow it, it seems so overwhelming, and then not knowing what to do with it. That's an example of this feeling. But it can grow. It can become more. You start having trouble finding your way around familiar environments. As before, we talked about individuals that drive out, and in this particular case, the individual goes out to the bank, which is a little, few miles away, and then on the way back, they kind of get lost. They're having a hard time navigating their way back. You become more impulsive and show increasingly poor judgment. So oftentimes we see this where an individual is starting to spend more money at the store or online shopping and things like that, depending on how they obtain product, and they're not really considering things like their budget and their cost of living expenses and stuff like that. Other risk factors and changes that your friends or family may see is depression, mood changes such as irritability and aggression, anxiety, apathy. Maybe they care too much or they don't care at all. And that can go one way or another. We see some of the nicest individuals you've ever have ever met can suddenly become not as nice as you know them to be, and then vice versa. And so we often see more extreme levels of altruism against apathy. Anxiety is very common, as well as the irritability and aggression. As a result, oftentimes depression does become a part of this equation. So some of the research suggested causes: brain shrinkage. Now, there's no single cause of mild cognitive impairment. We mentioned that earlier, and there is no single outcome for the disorder. So it's different for everyone, and it's based on lots and lots of variables. Symptoms of MCI may remain stable for years. It also could progress to Alzheimer's disease or another type of dementia, or alternatively, it could improve over time. Current evidence indicate that MCI often, but not always, arises from a lesser degree of the same types of brain changes seen in Alzheimer's disease or other forms of dementia. I should clear up here that it doesn't necessarily mean having MCI will lead to dementia. Some of these changes have been identified in autopsy studies of people with MCI. Now, those changes include abnormal clumps in the beta amyloid protein, or that's essentially plaques, and microscopic protein clumps of tau characteristic of Alzheimer's disease, and those are the tangles. This is essentially plaque builds up on certain parts of the brain and essentially cause damage. Lewy body, which are microscopic clumps of another type of protein associated with Parkinson's disease, dementia with Lewy bodies, in some cases of Alzheimer's disease. Essentially, what we're both looking at here is a clumping of a type of protein or a plaque that is, again, degrading or causing damage to the brain. Those changes do include small strokes or reduced blood flow through the brain blood vessels. As these plaques kind of constrict the brain, obviously they would, of course, restrict some of the blood flow. Brain imaging studies show that the following changes may be associated with MCI: shrinking of the hippocampus, a brain region important for memory; enlargement of a brain's fluid-filled spaces, the ventrals. This would add essentially, think of it as like swelling maybe. Reduce the use of glucose, the sugar that's the primary source of energy for cells and key brain regions. So kind of the picture view. If we look at the left side of this picture, and we're looking at the right hippocampus, and you see that it's kind of, it's a little bit bigger. And this is what it would look like if it's normal. When we look at mild cognitive impairment to the left or to the right, we see that it has shrank a little bit and looks a little bit more restrictive. All that to say, things are impacted and affected. So some of the complications. People with MCI have a significantly increased risk, but not a certainty of developing dementia. Overall, about 1 to 2% of older adults develop dementia every year. Among older adults with MCI, studies suggest that around 10 to 15% develop dementia every year. So we're looking at a 85 to 90% chance that you won't, based on this particular statistic. So we talked about cognitive impairment, and we talked about mild cognitive impairment. Here we're going to talk about precognitive impairment, and really what this is some of the things to consider and think about before we experience cognitive impairment. So the first thing I'd like to talk about is diagnosis. The benefits of an early diagnosis and early treatment. There's so many fantastic benefits of being ahead of all of any type of cognitive impairment. First, you get the maximum benefit from available treatments. As we know that medical developments occur all the time, and as long as we're able to stay ahead of the things that we may be experiencing, we can benefit from what is currently available. And in some cases, and we'll talk about this in a minute, we may also be able to get aboard on developing medicines. In particular, where we have Emory, and oftentimes dementia patients, now this is a little bit more extreme, but they're able to be a part of various studies that are looking at some of the advancements of medicine. So those things become available if your doctor is aware and has tested and has considered diagnosis, and maybe not a diagnosis, but certainly are now looking at some of the warning signs. But by having an early diagnosis or being treated earlier, you do have more time to plan for the future. As the host had mentioned, for me, I was a coach to help caregivers who were experiencing a lot of different things in support of their loved one who have dementia. And oftentimes what happens is without the ability to plan for the future, they're often hit with a bunch of different things at once, which puts them in crisis. And so having that time to say, okay, if this happens, this is the plan. If this happens, this is the plan. And it makes things so much better. As things come, you're able to deal with those things, and your perception of that stress is significantly reduced, which work toward your self-care. You can also look into the options to get help for you and your loved ones, not just the individual experiencing the cognitive impairment, but your immediate family and extended family as well, because ideally you would be receiving some type of family support, and the more information you're able to provide the family, for those that may not in the past have shown tremendous concern, that information can be the difference between them being more engaged or not. Your symptoms might be reversible. Again, we talked about certain circumstances, but it's not limited to medications and treatment for TBI. Some types of cognitive impairment can be treated, can be either through a regimen of various cognitive stimulus or medication. There are options, and so your doctor is the person that would be the subject matter expert, or they will refer you to a subject matter expert. To follow that, as a result, the symptoms that you're seeing or the cognitive impairment you're seeing with your loved one may be treatable. And with treatments, and this is just general illness, the sooner you get ahead of it, the better. So we're going to continue with some of the benefits. Diagnoses are more accurate early in the disease process. By being able to monitor and get imagery and run the appropriate tests, we're able to see even slight progression or variation, and so this allows your medical professionals to address things more effectively. It's empowering. By having the information, you're not blindsided with um, a whole lot of surprises. You're able to do your due diligence and you're able to do the research. You're able to look at things and say, okay, if this is the reality, these are the best practices. This is what people are doing, and as a result, you're empowered to be able to just handle things much better. You can focus on what's important to your loved ones. Your loved one can also make the best choices. We mentioned with mild cognitive impairment specifically, you're still able to do everything that you would normally do. And from a legal standpoint, if somebody is experiencing more severe cognitive decline, it's much more difficult to get certain things done, such as a will or to sign over power of attorney and things like that. And so while you're experiencing this in the preliminary stages, even if it doesn't progress, that individual, your loved one, is able to make the best possible choices and kind of draft the what to do if. You can use the resources available to you and your loved one. There are lots of resources and agencies that you can turn to, everything from your local area on aging to the council on aging. So you have some different options. Your loved one, as we mentioned before, your loved one can participate or advocate for research. So some hospitals are research hospitals, and some universities are research universities specific to certain types of impairments or disease. And so having that information may allow you to be a part of that scene and create, you can end up finding yourself on cutting edge science. You can also further people's understanding of the disease. Again, I saw this a lot, particularly with families who didn't understand. So because they didn't understand what the caregiver was experiencing, they became more distant. And as a result, the caregiver and their loved one became more isolated. And we mentioned earlier the importance of having that social stimulus, that mental and social stimulus. Isolation is a commonality that occurs with caregivers who are taking care of someone and their social supports don't understand or are not involved. So as a result, it will help your family, and ultimately it will help you too. So when should you see your doctor? Your loved one's doctor will evaluate their overall health and identify any conditions that will affect how well your mind is working. And as a result, the doctor may refer to them as a specialist. Before we talk about some of these specialists, every year you should, ideally your loved one should be going to their doctor for a wellness check. Some people like to do it every 6 months, and as you get older, your doctor may advise that. So that discussion with the doctor is important because we want to make sure that you're going in the frequency that is needed for your specific needs. Now, your doctor, what is going on in terms of the level of cognitive impairment or things that are going on with your loved one may exceed their particular field of study, and so they may refer to a specialist. And so a neurologist, they specialize in diseases of the brain and nervous system. In regards to cognition and impairment and neurological concerns, a neurologist would be the ideal person for that. They may also suggest a psychiatrist, and they specialize in disorders that affect the mood or the way the mind works. And sometimes we do see that often these two entities work together. A psychologist, now they have special training in testing memory and other mental functions. You may hear of a test such as a FAST examination or a RUDIS assessment. Those are just a couple of gauges to see where an individual is. A FAST is oftentimes used for Alzheimer's testing, and a RUDIS is a general memory and motor skill function test. They may also recommend a geriatrician, which is specialized in the care of older adults, and Alzheimer's disease. All four of these are fantastic specialists, and if your doctor recommends one of them, it's highly advisable that you do some research and figure out in your area which one of them are the most recommended. Research is helping us learn more about ways to maintain a healthy brain and about the risk factors for Alzheimer's disease and other kinds of dementia. While age and family history are risk factors, there are other things such as diet, exercise, and lifestyle are believed to have an influence as well. Now, the disclaimer. No one can guarantee that you will not develop dementia if you follow these things. However, research does show that there may be things that you can do to help keep your brain healthy and your memory sharp as you age. So, lifestyles. If you remember earlier that we saw a list of those things that create high risk, such as high cholesterol and smoking and diabetes and things like that. Well, these are kind of the combat to those. So some of those things that help maintain brain health are managing your health risks. And so when we talk about that, we're talking about managing your health conditions and keeping your body healthy, especially your heart. Your heart can keep your brain healthy, and so and this is by pumping that oxygen-rich blood to your brain. So the things you can do to help manage those health risks is to maintain a healthy weight, manage your blood pressure and cholesterol, stay on top of your health conditions, and that's such as diabetes. If you smoke, quit smoking, and for those types of things, seeing your doctor and getting advice on that is also advisable. Exercise regularly and get adequate sleep. The next thing is to eat healthy. What we eat may influence our risk for developing many conditions, including Alzheimer's or dementia. Incorporating a healthy diet into our lives is beneficial at any age. Eat a balanced diet with lots of colorful fruits and vegetables, high in antioxidants. Food may be especially good for your brain include green leafy vegetables, blueberries, broccoli, and cauliflower. Eat healthy fats found in nuts and certain fish, such as salmon, tuna. Fish high in omega-3 fatty acids may also be especially beneficial. Limit the amount of high-fat, sugary, or salty foods you eat. Drink in moderation. Some research suggests that moderate amounts of red wine may also contain healthy antioxidants. Some people also have done the research, and certain types of grape juice also offer those same antioxidants. Stay physically active. So when we talk about getting regular exercise, we want to stay physically active, and it's healthy for your heart and your brain. Your brain needs oxygen and a healthy blood supply to work it. A healthy blood supply to work is best. 30 minutes of exercise, 5 or more times a week is recommended, but we're busy, so do what you can. The exercise does not need to be strenuous, and this is really important. We think about, I got to go to the gym. Let's see how many plates of weight I can put on this bar. It doesn't have to be strenuous. Find something that you enjoy and that does fit into your current lifestyle. Simply walking or riding a bike is good. Take the stairs rather than an elevator. Exercise with friends. Again, maintain your social network, and that also applies to maintaining your mental and social stimulus. Play tennis or participate in team sport. Dancing can also be healthy. Swimming is a terrific low-impact exercise. Tai Chi or yoga can help improve balance and flexibility. The local Y in your area oftentimes offer those particular classes. But if you don't have access to those types of amenities for whether they're available or for cost-effective reasons, streaming platforms such as Netflix and others also offer some of these types of classes, these Tai Chi and yoga classes as well. So exercising and challenging your brain is a great way to stay sharp. Find things that interest you and that are fun. So when we talk about this, we want to engage your brain. Think about doing puzzles such as crosswords or number games. Read books, magazines, newspaper. The truth is, it doesn't matter what you read. Just read something. Learn something new. Attempt to learn a new language or a new skill, such as cooking, knitting, playing an instrument, whatever interests you. Try doing something in a different way. Take a different route to work, or try writing with your non-dominant hand, something that really is going to require some thought. And then teach someone a skill that you know about. One of the best ways to maintain good mental health and to engage your brain is to be a mentor in something. Especially our older generation, they have such terrific skill sets that I worry about oftentimes personally that may fall by the wayside. Personally, my parents both had exceptionally gorgeous cursive handwriting. So as a result, as I've gotten older, I've been practicing just to write cursive in different ways and with both hands. So those are just things that you can do on your own. Stay socially connected. People who regularly engage in social activities may be less vulnerable to depression, and some research has shown that social interaction may also help keep the brain vital and healthy. Find ways to maintain friendships and stay connected to others. We have so many different ways to connect these days. Everything from social media to virtual meeting platforms, much like the one that we're on right now. But stay active in your faith community. Volunteer for a local charity, school, or other cause. Join a social club or a travel group. Take a class. Oftentimes, cities have a historic district or an area where they try to advocate and increase community involvement. Look at what's available, and most of the time, those types of events are free. Host a dinner or a game night. As we get older, we like to think we've learned everything, and so have a Trivial Pursuit competition at home once a week. Maintain healthy relationships with friends and family. If you've been spending a lot of time alone, resolve to getting more socially engaged, especially if your loved one is becoming more isolated as well. Oftentimes what happens is when our loved one becomes more isolated, the caregiver, we become more isolated with them. We do need more than that. So try to engage in at least one new activity a day, or today could be the day. So try a new activity today. Keep the brain stimulated through social interaction. By building critical brain connections, this can also help your brain be more resilient. So these are some of the references that I covered throughout this presentation today, and I wanted to summarize this entire presentation by simply saying, as the caregiver, thank you for everything you do. You are incredible, and every day you perform acts of heroism that oftentimes go underappreciated, and so for that, thank you. The other thing I would like to do is urge you to consider that if you are experiencing, especially the early stages of what could be perceived as cognitive impairment, don't hesitate to get that looked at, and don't hesitate to have a doctor weigh in. It might simply be that the what the person is experiencing is reversible or is treatable, and that this particular path may not apply to you. Alternatively, if it does, then by being ahead of it, you're able to plan, you're able to do the things that you need to do effectively, which is going to cause as minimal impact and burden as possible, and it will allow you to have the time that you need to indulge in some self-care. And this is kind of the final message. As from me to you, the caregiver, you are critically important. And because you are so important, if anything happens to you, the family can be directly impacted. So it is not selfish. It is not a bad thing to take care of yourself. It's important that you get rest. It's important that you get a break. And it's important that you personally stay engaged in the things that you enjoy as well, even though sometimes time doesn't provide. And so creating that time is vitally important. In order to plan and to make the preparations, getting ahead of these things is key to that. And so by doing that, the goal would ultimately be to have the family and your friends to be your close support systems, to offer aid and support so that way you're able to do the things that you're doing. And again, we thank you so much. If you have any questions, this is our contact information. Down below is our website, as well as my email. I'm happy to answer any questions that you may have. And finally, thank you so much for everything you've done. The link to the post-test is at the bottom of this slide. And so, again, thank you for everything you do, and have a terrific day.
Well, thank you so much, Shiloh. It was such a pleasure to have you, and thank you for helping educate us on some risk factors. As Shiloh said, please make sure to take the post-test at your earliest convenience. Please also remember to view the other webinars in the RCI GDAS webinar series. Thank you so much for joining us, and we hope to have you join us again.